Greetings, 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 greetings to everyone. Greetings to everyone. Welcome, welcome, welcome to today's webinar. All right. My name is Michael Miner, and I am the Executive Director of the Oak Hill Regional Community Development Corporation and the Grant Authorizing Official for Healthy Kids Mississippi. Once again, welcome to today's third Wednesday Parent Resource Chat. We're excited about our discussion today, several topics that we want to go in. Hopefully it'll be helpful to you. We are excited about our guest and the material that we're going to cover. Look, as you always know, we are sharing this on our across several platforms. I think today we have 12 different Facebook and YouTube pages that we're sharing this to. So you can go to Healthy Kids Mississippi, our Facebook page, Oak Hill Regional CDC Facebook page, and share it with your friends, with your families. Look, even share it with your frenemies. All right, a lot of good information sharing. And look, we thank everyone for the wonderful feedback from last month's call and everything. And we're going to talk more at the end about the calls that we have coming up in August and in September. We'll see a little bit about what's behind me a little bit later, but you can see what one of our focal areas are. We do bring you greetings today on behalf of our entire board of directors, including our board chair, Jennifer Garrett, and our project director, Lottie Miner. We are excited to share about our health initiative also. Today, we're going to focus on three topics. We're going to begin today with an update from one of our great community partners, collaborators, you can say, because everybody that helps us work with children and parents, whether they knew it or not, they're one of our collaborators because we want to try to connect with them so we can connect parents with them. And we'll talk about the Tougaloo College Delta Health Partners. Also, Mary Fenner will give us some updates from Medicaid and CHIP, and then I'll close out with some further updates about the COVID-19 Delta variant pandemic. All right. Well, if you all don't mind, we're going to go ahead and get started today with our first presentations. Let me add on and look, we're excited today to have Miss Annie Perry Smith on with us. Let me say a few things about her. Today, she's coming in her role as a community care coordinator. And we already told you what our organization is. It's a Tougaloo College Delta Health Partners Healthy Start Initiative. A little bit about Miss Annie Perry Smith. And okay, let me bring our other spotlight in. There we go. All right. She is the state historian and state health chair for the Mississippi Homemakers Volunteers. She's also involved with Como Homemakers #2 and the Panola County Homemakers, where she is the secretary. She wanted me to make sure that you all knew that she is a member of the Siston Hill Baptist Church in Como, Mississippi. All right, where the pastor is Pastor Cedric Richardson. She also participates in the UAB, University of Alabama at Birmingham, a Panola County Chronic Disease Initiative. She has really been involved with a lot of other things with the church, and we're certainly glad to have her on today. Good morning. Well, can I be churchy? Sister Perry Smith. Good morning. Good morning.
Good morning to everyone. All right. It is indeed a pleasure for me to come before you today.
Wonderful. All right. Well, before we bombard you with questions, we're going to allow you to share your screen and look. As I said, I'm going to be church. Sister Perry Smith has some technical difficulties, so we're not able to have her picture on camera. But the next time we have her, we're going to have her live and in dual true living color. All right.
Am I ready to share my screen now?
You sure are. Go right ahead.
Okay.
All right. Sister Smith is working on that thing. There we go.
Good morning. I am Annie Perry Smith. Good morning. I am Annie Perry Smith, Community Care Coordinator with Tougaloo College, Delta Health Partner, National Health to Start Initiative, United Healthcare. Tougaloo College, Delta Health Partner, Health to Start, United Healthcare. Tougaloo College Delta Health Partner has served as a major support system for residents in the rural Mississippi Delta for nearly 20 years. Tougaloo College Delta Health Partner United Healthcare has served for 3 years. We are committed to continuing our consent effect to reduce infant mortality and improve health outcomes for mothers, fathers, babies, families, and communities. We serve the areas Bolivar, Coahoma, Quitman, Sunflower, Tallahatchie, Tunica, and Washington County. Our administrative officers are Dr. Arletha Howard, Project Director, 1054 Martin Luther King Jr. Drive, Marks, Mississippi; Mrs. Carol Mack, Field Service Supervisor, 540 West Main Street in Greenville, Mississippi; Mrs. Adriana Ellis, Administrative Assistant, 1054 Martin Luther King Jr. Drive, Marks, Mississippi. Our grantee is the Owens Health, Wellness, and Human Resource Center in Tougaloo College, 500 West County Land Road in Tougaloo, Mississippi. Promote quality services. Care management teams consist of licensed care managers, community health outreach workers, male involvement consultants. Serving available to project participants includes screening, case management, care coordination, health education, and referrals. Our location is the Marks office for Delta Health Partner. We have 2 nurses, 2 social workers, 2 community health outreach workers, 2 male involvement coordinators, 1 certified child car seat tech instructor, 3 certified car seat techs. For the United Healthcare, we have 1 nurse, 2 community care coordinators, 2 certified child car seat techs. And for the Greenville office for Delta Health Partner, we have 1 nurse, 1 social worker, 2 community health outreach workers, 1 certified car seat tech. And for the United Healthcare office in Greenville, we have 1 social worker, 2 community care coordinators, and 1 male involvement coordinator. We are fully staffed. Our vision is to impact high quality, comprehensive maternal, child, and family service through advocating and direct service provision in safe, health, family, and inclusive, thriving communities. Our mission, Delta Health Partner United Healthcare, is dedicated to reducing infant mortality, increasing positive birth outcome, and improving the overall health status and quality of life for women, children, and families in the Mississippi Delta. Improving women's health, Delta Health Partner United Healthcare Case management team conducts community outreach and recruitments in collaborating with partnering schools, hospitals, and other community agencies. Health coverage enrollment, coordination, and facilitation of access to health care service, support for prevention services, and assistance with reproductive life planning are major components utilizing to improve women's health, specifically women's of childbearing age 10 to 44. Health education. Delta Health Partner United Healthcare provides comprehensive, coordinated health education to project participants using appropriate curriculum via one-on-one and group sessions, written materials, hands-on learning, and referrals. Health education is provided in home-based, school-based, and community settings. For strengthening families, Delta Health Partner United Healthcare addresses toxic stress and supports delivering of trauma-informed care, mental and behavioral health care, depression screening, and promotes father male partners' involvement and parenting. Delta Health Partner United Healthcare is committed to providing comprehensive, culturally sensitive case management service to all infants, toddlers, mothers, and fathers, partners enrolled in the project. Tips for healthy eating, fast foods. Tips for making healthier choices. Fast foods can be tasty and cheap, but they are not the best choice when it comes to your health. The good news is that you don't have to completely give up eating fast foods. Here are some simple tips to help you make better choices when fast foods are on the menu. Are fast foods always bad for you? Not always, but many fast foods are too high in calories, fats, salts, and sugars. Learn what to order and what not and what to avoid. Choose your main dish wisely. Watch your portion size. Avoid the supersize options. Try a healthier side dish. Healthier options include salads, fresh fruits, baked potatoes, whole sour cream, steamed rice, black beans, or corn. Choose the right drinks. Healthier choices include water, unsweetened iced tea, black coffee, and fat-free milk. Eat fast foods less often. Limit how often you eat fast food. Your heart will thank you. A healthier pregnancy, healthier eating and pregnancy. Tips for good nutrition. Eating healthier foods during pregnancy is one thing you can do to give your baby a good chance of being born healthy. The foods you eat helps your baby grow. Each day, eat a variety of healthy foods. Eat plenty of calcium, iron, and vitamin D. Eat foods high in folic acid. Ask your healthcare provider about prenatal vitamins. Take a prenatal vitamin daily. Drink at least 6 to 8 glasses of water or other liquids each day. Say no to alcohol and limit caffeine. Talk to your healthcare provider about food safety. Eat 4 to 6 small meals a day. Most women need to eat about 300 extra calories each day before each because each woman is different. Ask your healthcare provider about your nutritional needs. Exercising and pregnancy. Tips for staying fit. Exercising while pregnant can help you feel better and give you more strength for labor. You may also recover more quickly after delivering. Talk with your healthcare provider before starting. A healthy pregnant woman should exercise on most days. Try walking or swimming. Warm up slowly. Avoid activities that may be risky for your baby. If you can take If you can talk normally while exercising, your heart rate is at an acceptable level. Wear cool clothes and don't exercise in hot, humid weather. If you lose your breath or get tired, slow down. Stop and rest often. Be sure to drink plenty of water. Eat well and drink lots of water. Stop and call your healthcare provider if you have any problems. Did you know that most women who exercise while pregnant feel better and are strong for labor? Talk to your healthcare provider to find out if exercising while pregnant is right for you. Hypertension, ways to prevent and control high blood pressure. High blood pressure, also called hypertension, can lead to heart disease, stroke, kidney damage, and loss of vision. Your blood pressure numbers may be your only warning sign. Know your numbers, know your risk factors, avoid or limit alcohol, get enough sleep, follow a healthy, follow a heart healthy eating plan, maintain a healthy weight, be more active. If you smoke, quit. Know about the medication you take. See your healthcare provider. Having your blood pressure checked regularly is the only way to know if you have high blood pressure. Although there isn't a cure for high blood pressure, you can lower your risk that through diets, exercise, and medication. Gestational diabetes. What you need to know. What is gestational diabetes? Diabetes is a condition that causes high level of glucose sugar in your blood. Gestational diabetes is a type of diabetes that can happen during pregnancy. If it can lead to health problems for both the woman and for her baby. If you are pregnant or planning to become pregnant, here's what you need to know. Am I at risk? All all pregnant women should be screened for gestational diabetes. Any woman can have it, but you have an increasing risk if you are overweight or not physically active and more. How will gestational diabetes affect me? During pregnancy, if your blood sugar is not under control. After pregnancy, you have a high risk of developing another kind of diabetes called type 2 diabetes. How will gestational diabetes affect my baby? If I have gestational diabetes, what should I do? Protecting your baby. Tobacco smoke and your pregnancy. Tobacco smoke can harm you and your baby. Smoking while you are pregnant can cause health problems for you and your baby. How can it hurt your baby? Your baby may be born too soon or too small. Protect your baby. If you live or work with people who smoke, ask them not to smoke around you or your baby. If you are pregnant and you smoke, quit today. Do not smoke while you are pregnant or after your baby is born. If you smoke, please do not smoke around women who are pregnant. Postpartum depression, what you need to know. Most moms expect to feel joy and happiness after the birth of a baby. It can be surprising if instead you feel sad or empty. But those low feelings called the baby blues are common. If feeling down lasts for longer than a few weeks, however, or if your feelings are severe, it may be postpartum depression. Here is what you need to know. What is postpartum depression? What are the symptoms of postpartum depression? Who is at risk? What causes postpartum depression? How is postpartum depression treated? What should you do if you think that you have postpartum depression for families and friends? If you have a new baby and you feel depressed, anxiety, or overwhelmed, you are not alone. Postpartum depression is a medical condition that affects many mothers of new babies. But but with help, you can recover. Clear and simple, the health benefits of breastfeeding. Better health is one of the reasons that breastfeeding is a good choice for both a mom and her baby. The benefits of breastfeeding can last a lifetime. Why is breast milk a good choice? Breastfeeding starts right after the baby is born. Breast milk gives a baby a healthy start to life. Babies who are breastfed may be a healthier weight when they grow up. Breast milk helps keep a growing baby healthy. Ask your doctor if there is any reason you should not breastfeed. Breastfeeding can take some practice. Other family members or caregivers can feed a baby with pumped breast milk. Breastfeeding is good for mothers too. Women who breastfeed their babies have a low risk of type 2 diabetes. They also have a low risk of breast cancer and ovarian cancer. Safe sleep for your baby. Reduce the risk of sudden infant death syndrome, SID, and other sleep-related causes of infant's death. The infant sleep area has no bumpers, pillows, blankets, or toys, and is in the same room with their parents sleep. SID is the sudden unexpected death that doesn't have a known cause even after a full investigation of a baby between 1 month and 1 year of age. Always place baby on his or her back to sleep for naps and at night to reduce the risk of SID. If babies roll over on his or her own during sleep from back to stomach or stomach to back, there is no need to reposition the baby. Starting sleep on the back is most important for reducing SID risk. Use a firm and flat sheet surface, such as a mattress in a safety approved crib, covered by a fitted sheet with no other beddings or soft items in the bed in the sleep area. Do not put soft objects, toys, crib bumpers, or loose bedding on the baby, over baby, or anywhere in baby's sleep area. Parenting together, building strong families. All parents want to be the best parents they can be. Parenting is a very hard job and being challenged to a relationship. Following these tips will make your parenting easier and your children's healthier. Learning to be a good parent take practice. Good parents provide their children with ongoing affection and clear limits. Be a unit team. Parents who give their children the same answer helps them feel safe and protected. When you disagree, sometimes parents disagree about what is best for their children. Taking a parenting class together can be very helpful. Many are low cost or free and often includes childcare. Be loving and respectful of each other. Parents who show respect helps their children learn respect. Delta Health Partner United Healthcare is supported in parts by the National Healthy Start Initiative through the Maternal and Child Health Bureau, Health Resource and Service Administrator, United States Department of Health and Human Services. My questions?
All right, all right, all right. So we're gonna get you off there. Wow, thank you. I said again, I'm being churchy. Sister Annie Perry Smith, you covered a lot of ground. Well, you covered so much ground, I'll never sink. All right. Okay. Look, let me just ask a couple of questions I love to always put out there. All right.
Okay.
About how many people have y'all impacted since you started working with the parents now? Look, about 20 years ago.
We have a number of parents that we have to serve 300 per year,
Okay.
plus the babies, plus the fathers.
Okay. All right. All right. So then your focus then is of the whole family. You know, a lot of times when they have these programs, you want to make sure the mom and the unborn baby and then the baby. But what if I'm getting here? You have this male involvement part. So you want to make sure, look, even if there's a baby daddy drama, you still try to get everybody involved. We lost you, Sister Perry Smith. Are you still there? All right. Sister Perry Smith. Well, you know, one thing when you're working on Zoom and this technology, wow, we lost her all the way. Just froze up and she went off. Well, let me go on some of the other notes that she sent us ahead and working with this. And again, we thank Mary Fenner for connecting us to, as I said, we'll be in church today, to Sister Annie Perry Smith. Also, before we forget, we remind everyone, this is the third Wednesday resource chat of the Oak Hill Regional Community Development Corporation through our Healthy Kids in Mississippi initiative. My name is Michael Miner. I'm the Executive Director of Oak Hill Regional Community Development Corporation. All right, so some of the notes that Sister Perry Smith left with me was saying the importance of male involvement. Male involvement. So one of the key things that I picked up from what she shared today and what she shared from the material that she gave us earlier is this, is that it's great, wonderful. We got to get the moms when they're pregnant to go through all the prenatal. That's all good, and it's good for when the baby's born to follow up with that. But it's important to have the father involved, and for any number of reasons. You know, sometimes there's some drama associated with it on either, you know, sometimes before or after the baby's born. But let's just face facts. Whatever the case may be, that gentleman has had a part, and will continue and needs to have a part in the child rearing process. So my hat's off for them. And I like the idea that they actually have a male involvement consultant that actually looks at that. So what does that tell us, everybody? That tells us that really their program has people that are working with the mom, literally people working with the baby, and then there's people working with the father. And doesn't that make sense? So that you got different folks working at different aspects of this family relationship, and hopefully as they do this, they can make this work. Another thing I picked up on from the notes that she sent us, I love this child car seat coordinator position. When I saw the movie Why Did I Get Married? Or was it Why Did I Get Married Too? One of those two movies, the Janet Jackson character, she lost her baby in an accident. We know this is fictional, but I wanted to share the story here because the car seat was not, she did not secure it appropriately. She had an accident and her baby was killed. So I think that's great to have this. And look, that's something we should share in our families with. We're doing this to make sure, especially some of these young mothers, they know, number one, the appropriate seat to have, the appropriate place to put the seat, okay, and then how to put the seat in properly. It still just shocks me, bothers me when I see young mothers riding on the highway with the baby in their lap. I like cringe when I see that. So we need to look at that aspect as well. I guess I'm not old as I'm going to be, not young as I used to be, but I am old school. I think it's important for breastfeeding. I think that's great for for moms to get their children headed off in the right direction. And then also I bring this up because August is National Breastfeeding Awareness Month. There'll be a lot of material and stuff coming out from the U.S. Department of Health and Human Services. We hope that those that are watching on Zoom and also on Facebook and YouTube, you'll avail yourself of that material and do so. And then, you know, sadly, she talked about postpartum. Wow. We don't get enough discussion in general about it, and especially when it comes to women of color. This is July's National Minority Mental Health Month. We need to really look out for our, especially young mothers after they have the child. Just as she said, after the initial joy, the exhilaration, everybody's there and whatnot, sometimes the depression hits afterwards and can get suicidal even with the child. So we need to be mindful of that. Look, let me let y'all know something, especially in our Black community. If a person gets a cold or they get the flu or even they get COVID-19, we're at the hospital, we pray for them, we say they're sick, and we look at some ways of getting medication or treatment so that they are made better. But then when people have mental health issues, we call them crazy and we do things so people want to hide it and whatever else. But I want y'all to know, mental health, when we have a mental illness, in many, many cases, that is treatable and you can be cured. So we want to make sure that we have that in mind as we think about focusing on some of the things with postpartum. And she reminded us that when we go through, isn't it something when you go through some of these restaurants now, you can get the small, medium, or the super size for the same price. So what do most people do? They get the super size. Now, look, I must admit, sometimes if we're really pushing on Sundays, my wife and I after church, we got to go different places, and I need to get a certain number of calories into me by 2:00 Sunday because I've had my big breakfast earlier. So sometimes when we get in a hurry, I'm gonna tell you what I do. I have discovered that if you get one of those fruit flavored crushed drinks, it's 160 calories. Yeah, 160 calories. I was like, oh my God. You drink one of those things, I'm telling you, it will help you if you get a calorie crunch. But flip the script. If you drink one of those drinks with a sandwich, calories, oh my goodness, there's a lot of calories in it. I just looked at the bottle and said 160 calories in one soda. I've found myself, since I'm involved in health, to start looking at those bottles, those the labels, and see what the calories are. Now, don't use me as an example when it comes to eating, because in my system, I have a high metabolism. Yes, I don't have that Dunlap in the belly yet. I don't put on weight, so I have to do those things to make sure I get my good caloric intake. As I always say, make sure to check with your health professional, because what can help you can kill somebody else. Don't believe it? I was in a meeting about 15, 16 years ago, and a lady said, y'all need to make sure you eat plenty of nuts. Yeah, the pecans and almonds, peanuts. I had to hold up. Man, there's a lot of people that got allergies to those things, and it will cause them to go to anaphylactic shock. And so, like I always say, we need to be careful about what we encourage people to be a part of. All right. And the thing about this this Tougaloo College Delta Health Partners Healthy Start is that they have been doing this for about 20 years, and they've been able to maintain funding. That ought to just be an applause. There's a wonderful line there, because so many organizations that start things, it's like a car on bad gas. They start and stop. And they've been able to do this, you all, for about 20 years there in the heart of the Mississippi Delta. Isn't that wonderful, everybody, that they're able to get this done? All right, Sister Perry Smith also told me about the focus of the efforts. May I read this? I think this is nice. I think this is wonderful and brings it together. She says, and then says, we, the Tougaloo College Delta Health Partners Healthy Start, says, we are committed to continuing our concerted efforts to reduce infant mortality and improve health outcomes for mothers, fathers, babies, families, and communities. That is so rich, you all, so rich, because if you really bring all this in together, it will make better communities. And so we certainly wish them the best. And we're also thankful for the U.S. Department of Health and Human Services for having these programs that allow you to be a part of it. Well, look, if you're in one of those counties, Bolivar, Coahoma, Quitman, Sunflower, Tallahatchie, Tunica, and Washington counties in Mississippi, you can give them a call at 662-326-3673. That's in Marks. That's 662-326-3673. Or in Greenville, 662-335-4300. That's 662-335-4300. And for those that are watching outside the Mississippi area, we certainly encourage you to Google and find assistance. You may be through a very qualified community health center, a community clinic, or you can go on to websites like the U.S. Department of Health and Human Services Insure Kids, a webpage that find great information, great tools that can help us to make our children, our babies, get a great start. The one last thing that I want to share is that we have to do something, you all, especially here in the South, about infant mortality and even mother mortality of Black women. It just makes no sense in a country like America with the best medical care supposedly in the world that we're having women die at childbirth. We're having babies to die within the first year of birth. We need to take this thing a whole lot better. We're calling on moms and grandmas, great grandmas, to really make it a village type thing as we're working with these expectant mothers to share with them and the things that they're doing so that it will make things work out a whole lot better. All right. Again, we apologize that Sister Annie Perry Smith had issues there, but I thank you. Again, these members of Sister Hills are on point and have things together, and they are have the background information available for us. All right. Okay. All right. So she's back on as Adriana Ellis, but we don't have a microphone for her. Okay. All right. I tell you what we do. While she works on a microphone, we're gonna bring Mary Fenner to come up and give us some quick updates on our Medicaid and CHIP, and then we'll see can we get the microphone going for Annie Perry Smith. Sister Fenner.
Yes, good morning, everyone. I'm glad everyone was able to join us this morning. The only update, well, in case people don't know, we're Healthy Kids Mississippi, and we're here to assist you with any issues or anything that you have containing to Medicaid for yourself and your children, such as applying for it, renewing your insurance, or either if you have any questions, we can help you with any questions that you may have. The only update that I have is that now some of the Medicaid offices are open to see clients. Not all, but some are. And I guess if you need to go in and see or talk to anyone, then you need to call the office first and see if they're open, or either call us and we can assist you with that as well.
With my chat box.
Okay. All right. Well, look, can we just, Sister Fenner, could you just give us, it's really great. You've been sharing some stories of some of the people that we've helped over the last month. I know we can't include any PII with their names or their locations, but can you just give us a little taste of some of the folks that we've helped over the last month through Healthy Kids Mississippi?
Okay, some of the people we have helped are people who didn't know that their Medicaid had ended. They may have went to the doctor and saw that they no longer had Medicaid, so they called us and we were able to put in applications for them. Also, we help people with renewing their Medicaid application. So we have done that, and since we've been in existence. So
You can say if you want to.
if you need any type of assistance or anything like that.
Go ahead.
Okay, you can give us a call, and our number is 662-298-3584. And we even have a text number, is 662-689-9712. So if you have any type of Medicaid questions, we are here, Medicaid or CHIP, we are here to help you, assist you with anything that you may need.
All right. That sounds so wonderful. Thank you so much, Sister Fenner.
You're
All
welcome.
right. All right. Okay. So, Sister, we'll go back to again, Churchy. All right. So we're going back.
Dr. Manner,
Okay, we got you. So look, we got you back. We covered stuff. So we got about 5 or 10 minutes here. So we got you back, Sister Annie Perry Smith. Okay.
I am so sorry, but I am on my co-worker's computer, technology, but nevertheless.
Okay. All right. Well, let's do this. All right. So we went back. Let me ask you a couple more questions here, and then we'll see if any questions. You can type those in the chat.
Okay.
So I gave the one thing we talked about. Can you quickly give us a little bit more insights on that your male involvement consultant? What are they doing working with the parents?
The male involvement consultants, we have 3. We have 2 in the Mark's office, DeJuan Watt and Justin Dishman, and they cover the 7 counties for Delta Health Partner. And we have 1 male involvement that's in the Greenville office, and he's with United Healthcare. So he covers all the counties that we serve. But they go out and they talk to the males about parenting with the female, or either co-parenting if there's a situation where they're not together anymore, trying to make sure that the male is still involved in the baby's life.
Okay. All right. That's great. That's great.
They also have a lot of different outreaches. They set up in different barbershops to make sure during June for Men's Health Month, they do a pop-up in different barbershops where they have collaborated with them, and they give information about men's health.
All right. And also for those that are watching outside our area, and of course, I want to give a shout out to Sister Sharon Childs. She's always sharing information from our National Baptist when we rebroadcast this, restream it on the website. We also want to remind everybody about the national initiative from the Obama Foundation, My Brother's Keeper. My Brother's Keeper, you can Google that, go there, and there's a nationwide initiative on how we can get the barbershops powered up to provide healthcare tools and tips for our Black men. All right, well, look, let me get personal, Sister Smith. How did you get involved in this? What fired up your passion to be involved in this line of work?
To make sure that each family have information about healthy eating, make sure that their babies are healthy, make sure that the pregnant woman is healthy so she can have a healthy baby. It's just a passion that I have concerning health.
Well, let me do you like I did Sister Fenner. Are there any stories? Of course, we won't give any personal identifiable information. Were there any stories that you'd like to share of people that you all have worked with and helped?
We have different collaborators that we work with, and we also work with the diaper bank of the Delta, where we have our clients sign up so they can receive free diapers once a month and diaper wipes for their babies. Also, we have car seats available for our clients if they need a car seat, and the certified techs is the persons that have to install the car seats. And you know that once you have a baby, you're not supposed to leave the hospital without the baby in a car seat. And most of the time you can get a car seat from the health department.
Okay. All right, yes, I think a lot of people forget about that or don't know about it, whatnot. That's important to ensure the safety of the babies. All right. We've come a long way from back in the day when we thought the safest place was in the mother's arm on the passenger side. Oh, wow. How far, fortunately, we have come. All right, is there anything else? Remember, is there anything else that we didn't cover or anything else you'd like to say before we end up this segment?
Not anything else that I would like to cover. I would just like to apologize for my technical difficulty, but we are in a computer system world, and nevertheless, I was able to get back on and talk with your audience.
Well, it doesn't matter. You're in Mississippi. So, excuse me, say it correct. You're in Mississippi. And you're gonna have some issues because we don't have the what is it, the Wi-Fi, the high-speed internet across the country and then down in the net. So we just thank you because look, we know those folks, those what is it, what y'all, them golden cougars, y'all find a way to persevere. Is that correct? Am I saying that correctly?
Who is the golden cougars?
Oh, that North Panola?
North Panola cougars, but they're not golden.
Well, I had to put something on it though because I'm a Coldwater cougar, so I didn't want to say the same thing to get it confused and get some of my Coldwater folks to jump on me. That's why I had to come
North
up with
Panola Cougars.
Oh, okay. Well, I didn't want to get in the way of the original Coldwater Cougars. That's all.
Ah. Okay, Pastor Montgomery gonna be on you now.
All right. Look, everybody. Look, we have fun on these calls each third Wednesday. But again, we want to thank you so much, Sandy Perry Smith, for being our guest on today. We certainly and Sister Fenner will stay in contact with you. Of course, anything that we can do from Healthy Kids Mississippi or Oak Hill Regional CDC to assist, we will do that. Okay.
Okay, we will be planning a virtual health fair in October, so I may be reaching out for you to be one of our guest speakers.
No problem. We can do that. And guess what? I won't even charge a fee. I won't be like the preacher. I won't even ask for a love offering. I just be glad to participate. Okay. All right. Thank you there. And thank you for your coworker, Sister Adriana Ellis for
Adriana
stepping in.
Ellis.
Adriana, thank you so much for stepping in for your coworker. All right. Okay, everybody. Let me mute that. Okay, let me give you a few updates on our on the COVID-19. I decided not to even worry about giving you the numbers from the state nationally. Folks, we are going backwards, quick, fast, and in a hurry. This Delta variant is running rampant. Let me just do this. I got about 5 minutes here. So what happens with the COVID-19 virus? It's got a bunch of spikes. As you can see behind me here, there's spikes. There's spikes on this virus. So when these virus, when the vaccine comes in, it is alerted to these different spikes. And that's how it's able to work. So basically you get the vaccination. They're saying that if you get the 2 shots of the Pfizer, 2 shots of the Moderna, you may get, it may have a breakthrough, which is on not a real big thing right now, but you can be assured that you may get sick, but you won't die or be hospitalized. The concern is though that a lot of people in Mississippi, I think we may have gotten 35%, but the vast majority, black, white, whatever, green, yellow, blue, have not NOT taken the vaccination. That creates 3 problems, folks. Number one, it gives has people who are going to die, because right now, pretty much everybody that's in the hospital in Mississippi and in the Mid-South area have not been vaccinated. They are on ventilators and they are dying because this COVID-19 Delta variant is very contagious and is causing a lot of problems. That's one thing. Okay. The second thing to look at, and when we're going through this, is that it is a threat to people who've already been vaccinated, because we're having some of this breakthrough stuff because they're around people, their friends, everybody's not wearing masks and stuff who don't have it. And even though they're not have to go to the hospital and whatnot, just the idea of being sick and going through and whatnot is problematic. And the third, and I think to me is the most important thing for us to realize, is that by having all these people that are not vaccinated, it allows these variants. There's even a Lambda variant that they're concerned with now, that maybe if it keeps on going, one of these variants will be so bad that our vaccinations will not work. The vaccine will not work. So that is my concern. So again, behind us, protect yourself, protect others, get vaccinated. Also, wear your mask. If you're indoors, slow to spread, wear a mask. Try to avoid being around people who are unvaccinated as well. And please, y'all, trust the facts, get the vax. There's not any little devices in the vaccine. It's not going to make you sterile. I mean, I can go on and on and on down the list. And within the next 30 days, the Pfizer vaccination will be off emergency approval and will have full approval from the FDA. So that'll be one less thing that we have to worry about. So that, look, let me get off my soapbox for that and let you all know to get your vaccination. All right, let me bring it back up again. Thank you. And again, we're going to shout out to our technical support person, Thomas Duke Robinson. Remember, folks, if you need help with insurance, your family, give us a call, 662-298-3584. Check this out. We're going to work with you to get you to see a health professional. All right. Look at all the free services we provide. All right. We can work with your family for your Medicaid or CHIP enrollment. All right. If you qualify, or right now, the Affordable Care Act open enrollment is continuing through August 15th, special enrollment period. There are a lot of people right now who are qualifying for the Affordable Care Act, Obamacare, and getting that done. And look, if all those fails, we're going to work with you to connect you with a federally qualified community health center who's able to see you on a sliding fee scale. Look, give us a call. We want to work with you and connect you through health coverage or community health center with the health professional. It's better to prevent some of these things you have than to get sick as well. I've told pastors, I wonder what some things they can do. We have this post-saints offering we have. We call it benevolent. So what you may have to do is this, is that sometimes a person may have medication and they can't afford the $25 deductible. It's cheaper for the church to give them $25 a month than to try to have a fundraiser once they get sick. I'm just saying. All right. I think Duke hasn't shown me anything else out here that we have. So I think that we're good on all our questions and answers. All right. In August, we're going to have our team. Our team will be back and we'll provide some updates. Our August, third Wednesday will be Wednesday, August 18th. And then in September, on September 15th, we'll have Dr. Susan Woodford, who's going to give us an update on our children and our vaccination. So the next 2 months, again, August 18th, September 15th, our third Wednesday. If there are some topics you'd like us to cover, just let us know. We're more than happy to work with them and get those done. All right, and in between, if you got any questions, email us. And we won't have to wait till the third Wednesday. We'll respond. All right. Well, look, we thank you all for joining us today. All of our team, all of our staff members of Healthy Kids Mississippi, we thank you all for making this possible. We want to remind you all that this has been a production of Oak Hill Regional Community Development Corporation, where we focus on belonging, building, and bridging in the Mid-South region. Thank you for joining us for today's webinar.